I have irregular periods. But when I calm down, when I find a way to go inward and take the stress away, then my periods are regular. So a period is a barometer of a woman's stress level.
Oh, wow. Okay.
My question is, did they find cysts in your ovaries?
I think at one point, yes, we did find cysts on the ovaries.
How many cysts? Oh, at one point. But when they do the ultrasound, do you have cysts in your ovaries?
Yeah, I had to do a TB test or something.
No. Have you had any? How many cysts did they find in ovaries? When was the last time you had an ultrasound?
I haven't had an ultrasound because my periods have been regular.
I rest my case. This is showing. Even though you might have cysts in the ovary, doesn't matter. The cysts are an incidental finding.
Yeah, that's what my doctor told me.
Is your stress causing you? So is there a diagnosis of a syndrome? A syndrome is a bunch of things they put together because it's just like you have to go to a doctor. They have to give you, it's for doctors. You know, I'm a gynecologist. It's just like I have to give you a diagnosis and check a little box in the form. But we demystifying it. You said, my periods are regular when I have no stress. So I cannot say you have PCOS. I have to say you have stress.
You just hit it on the head because you're right. I did go to my OB-GYN the other day, and she's talking because obviously I have this lifestyle change, and she's like, well, how's it going? And I'm telling her everything, check it off, that I'm kind of like okay right now. She goes, if you're having a regular menstrual cycle, there's no reason for us to have the ultrasound or even TB test, which is that transvaginal imaging.
Yes.
Because you're
it's okay. Let's clarify it for the people out there. Ultrasounds are done in two ways because you said like I'm having an ultrasound and a TB test. Ultrasounds are made two different ways: transabdominal and transvaginal. Before they have it transabdominal, then with technology they can stick something in the vagina like a fake penis and they cover it with a condom to do the test.
Right.
That's an ultrasound. It's called transvaginal ultrasound. Transabdominal ultrasound TAU or transvaginal ultrasound TVU. So let's clarify.
Thank you for clarifying that. I appreciate that. Yeah. I did have both of them done because I did do the topical ultrasound first. And
transabdominal. It's called transabdominal.
Right, the abdominal, and then I guess the imaging wasn't good enough or
wasn't clear.
Right.
Wasn't clear. So years ago, it wasn't clear, so they defined it so they can directly in the vagina because the ovaries are right there.
Right, exactly.
And they just put it to the left. They see your left. To the left is your right ovary. To the right is your left ovary.
So this leads to my next question. There's a big misconception right now. I've been reading up a lot about this PCOS because, again, like you, I'm not looking to just, take medicine. I want to look at other ways to heal and evolve myself. A lot of people, there's a big argument, if you will. One set of people are like, listen, PCOS is what it is. It's not something that can be reversed. And then there's the next set of people that says, listen, PCOS can be reversed. Now,
all right. Remember, I told you, that's the kind of medicine I do.
Mm-hmm.
I consult one woman. I'm asking you, do you have PCOS or do you have stress? When you have stress, you have irregular periods. So my diagnosis for you is stress. So you need stress management.
Right. Well, yeah, I think the majority of people out there do already.
Yes.
But let's say we're talking about, for instance, someone that you've seen and you can confirm a diagnosis of PCOS.
Yes.
Is that reversible in that person?
Remember, we have to put into consideration that it's the incidental finding.
Okay.
So some people might have a slightly elevated testosterone. Some people might have seen, some patients will call it truly PCOS, but to me, it is, how would I say? Do you know when somebody has the symptoms, as a diagnosis, when the symptoms they're talking about it change because of the stress, like the period? The first one is the irregular period. An irregular period can cause.
Are you talking about an indication? Like
no, the diagnosis. This is for the diagnosis. This you have to have irregular period. The diagnosis means if you're having at least two of these signs: irregular period, polycystic ovary, or excess androgen. So let's put it this way: I'm so glad we're using you because when you have to have two of them out of those three. There are some women, I would say, truly they have the PCOS. Where they have acne, they are overweight, they have a lot of cysts in their ovaries, and then that's because they don't ovulate, that's why their periods are irregular. Yes, there are some women who are like that. Okay, my question is, let's say the diagnosis is made. What is the concern that the person should have? The concern is, number one, when I used to be in practice, and my patients will go, oh, my periods are irregular. And then I said, do you want to get pregnant? Or do you want to get pregnant? No, I don't want to get pregnant now. Okay, put it on the pill. Or some would say, I don't want to be on the pill. So I would say, you need to have a period, because remember, you have the more you stay without the period, the lining of the uterus is growing. So that's the concern. If it's growing and growing, so you have excess estrogen, so you might eventually, which is very uncommon, to have early endometrial cancer. So what I did with those patients, I give them a progestin every 3 months. And I would say, how often do you want to have your period? 3 months? Okay. 3 months, you use it Provera 10 milligram and take it for 10 days. And then after you stop for 3 days, essentially it's just like I'm making you ovulate. I'm giving you the hormones that if you would have ovulated, then it's going to counteract the effect of the estrogen. You're going to bleed when you stop it. Period. So let's do that every 3 months. There is not a one-size-fits-all. That's why I left medicine. People come to me and I say, like with you, I would have seen, if I have seen you beforehand, before you start getting pregnant, I would have said, what's wrong with you? Most probably your periods would have been regular. And if it was irregular, we'll say it still continued to be irregular in spite of you doing all the stress management and everything. And then I would have, and if it's still regular, I would say, okay, when you come to me, I would look at you. I don't look at the diagnosis. I look at you. And I said, Lena, Doc, I've done everything. I meditate. I do all these things. And then my period is still irregular. I said, okay. At that visit, I would say, would you like taking the pill so you regulate, you don't have to worry? Or do you want to have me giving you progestin, give the prescription you take every 3 months? You choose when you want to have your period. You calculate if you're going to go on vacation, you want to have your period. I'll show you how to calculate it, and you have your period. But after that, when you go to menopause, who cares? The ovaries, you don't have to worry about ovaries, ovulations, and all those things. So,
right. Okay, so what I'm getting from that is the diagnosis or the notion, I'm going to say notion, of PCOS is really more symptomatic and depends on the indication. So therefore,
the individual.
So therefore can be in some ways reversed to some extent as long as you're leading the appropriate lifestyle to reverse those symptoms. But myself.
I wouldn't say, I wouldn't equate it that you're reversing PCOS. You are given a diagnosis.
Right.
I would say you can reverse your symptoms because the symptoms, that's what make the syndrome.
So you could reverse the symptoms, but you can't, if a person is truly diagnosed with PCOS, you can't reverse it because that's something like something you're born with. Yes. Okay.
Yes, you were born it. Yes, then when you have it, you have it. And then so the concern is now, you increase risk, all the increased risk that you may have. Right. Then we're going to make sure that the most thing that we want, the two things, the most important is that you cannot get pregnant. So we're going to give you Clomid. That's what I tell my patients. When you're ready to get pregnant, let me know. Okay. And then they will say, I'm ready to get pregnant, and I will give them Clomid to get pregnant.
That was extremely, extremely insightful. I really appreciate that insight. It certainly helped me understand a lot about myself, quite frankly.
Of course.
So let me ask you.
That's the kind of work I do.
Okay, well, what lifestyle would you recommend that person lead, and what care should that person take?
So let's say you diagnosed with PCOS. You did have a regular period, but now your period is regular. So I would tell you, Lena, when you take the stress out of your life, your periods are regular. You don't have to worry about anything.
Right.
Right?
Yeah.
So I go by Lena.
All right. So that means Lena has to it's not only the stress. And I'm guys, you guys that are listening out there, I'm talking to all of you now. It's not a magic button to take stress out of your life. It's implementing those different things that find balance, that kind of like relieves that stress. For me, it's going out and walking. I go out and I have that time with myself and I walk. I have that alone time. I rejuvenate myself that way. So I guess in some ways that exercise helps me mentally, emotionally, as well as physically. Okay. That's Lena. One example we could use. Yes.
Lena. Let me tell you, Lena, what I found out.
Tell me.
For the kids in medicine. Why are you stressed? When people come to me, imagine, let's go backward. Irregular period. We know for you it's stress.
Right.
Then, while I work with you, I don't tell you to walk. I don't tell you to take this supplement. I don't tell you to take anything because I'm working with Lena. I will ask Lena, why are you stressed? So I will tell Lena first, I will discover with Lena the root cause of her stress. Because Lena needs to know what stresses her.
Right.
It's just like, you see what I'm saying, Lena?
Mm-hmm.
The symptoms people go to doctor are the roof symptoms, like the roof is leaking, right? It could be you have anxiety, you have diabetes, you have irregular period, you cannot sleep, etc. Your hair is falling, blah, 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 blah. The way I call it the true healing, the root cause, I would say, Lena, let's go into the foundation.
Mm-hmm.
Because the symptoms, I call it the tip of the iceberg. So, Lena, my question will be, what caused you to be stressed? Because we find out now if you're stressed. When you're stressed, you're irregular. So I would say, Lena, let's go and find out why are you stressed and why you have difficulty dealing with the stress. So what I work with my patients, and that's what my education is, you have to find the root cause of your stress. What is your stressor? Why can't you deal with the stressor? You found, let's put it your way, you find that you don't know what's causing your stress, but you know when you say stress, we know when you walk, it's good for Lena. But some people might be walking until they're blue, they stop having period because they exercise too much, they still stressed, right? So you see what I'm saying? So we have to make the people understand. They have to try to, instead of putting themselves in the box with the diagnosis. Also, the other thing is that you mentioned that you have diabetes. Do you know what causes diabetes? Sugar? Stress.
Okay, that too.
You see what I'm saying?
Yeah, it's all related.
It's all related.
Yeah.
And then if you look at it, then they say, oh, if you have PCOS, you're more likely to have diabetes, you're most likely to have obesity, you're most likely to have cardiovascular disease. Lena, they all stem from the same mother. You found out for you, because, for the people who find out, okay, this is why you have the stress, that's what I do.
Right.
Then you deal with the stress. Because the stress is causing you to bleed. The stress is irregular period. The stress is causing you to have diabetes. The stress, blah, 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 blah. And with time, you're 38, there'll be more and more. Because it's the body trying to keep up with you.
Right.
So that's why the work I do, and I said, let's find out. So we sit down, we do a 2-step process to find it, and I show you the tool. You already have one tool, but then the tool is just like one way to deal with the stress. But what about keeping the stress from happening?
Wow. Yeah. I don't think I have allowed myself to acknowledge that, because I guess that's I have to do that. I've got to spend time to acknowledge really and truly root cause. Like, what is stress? That's
what is causing you for your period to be regular. But so let me explain for the people who are listening.
Mm-hmm.
When you have stress, because when you have stress, it's going to alternate the body from the hair, from your head, the hair in your head, to your toenails. In between, each person is going to come with a symptom. You see, what is telling you, my body is not responding. What I'm doing in my life is not good. So that's why you are sick. So that's why we're treating symptoms. And we package them together. We call them syndrome. You see, PCOS, polycystic ovarian syndrome. When we are off balance, it's going to express itself into an emotional or physical, with time, a physical symptom.
Mm-hmm.
But what do we do as humans? We have to have an answer right now. Oh, my bleeding appears very irregular. I have anxiety. Oh, I can't sleep. I want a sleeping pill. I want to have my period. So we're treating the symptoms. We're treating the roof that is leaking, not taking the time to find out why. Why can't you sleep? Why is all your period irregular? Why you losing your hair?
This is an extremely enlightening for me, Dr. Carolle. I can't thank you enough for taking the time to come in here. I certainly have a few answers I need to answer or ask myself, as I move forward. And I can see how getting to the root cause will help me or anyone.
Thank you. So
in longevity.
I'll give you a discount.
Very cool. Well, guys, you heard it from the lady herself, Dr. Carolle, True Healing. I will include links to your website and your email, and as well as the name of your podcast. Is your podcast currently airing? Are you up yet?
It's not airing. I'm starting because I am finishing putting on my website together. So starting with my podcast. this week.
Very cool. Well,